My name is Jonathan Koffel, and I'm a clinical information librarian here at the Biomedical Library at the University of Minnesota. And I work primarily with the medical residents, who are the physicians who are training in specific specialties. I think a few of the interesting things that I've been working on lately, or novel things, is with the residents, I participate in morning report and patient rounds. So morning report is where all the residents and then the attending, the faculty physicians, gather around and discuss a particular case. And what I do is attend these case discussions, and I'm there to help find best evidence, so research articles about what the best diagnosis or treatment or prognosis information is about the particular patient. In addition, I also attend inpatient rounds with our neurology department. So this is where we go from room to room, looking at rounding on specific patients and trying to look at ways to better diagnose and treat them and so forth. And my role is, before rounds to begin, is we discuss all the patients. I try to find information to questions that the residents or faculty might have. Then during rounds, I keep going. I switch to a mobile tablet, and I go around and bring up information, passing my tablet off to them. And then the information I use actually gets incorporated into the recommendations the physicians make. And these are great, I think, because they're an opportunity for me to inject library practices, best information, literature searching, all the typical things that librarians try to teach users about, inject it at the right time in the right place. So this is where the users actually need it, where the residents and the physicians actually need it, rather than teaching it 6 months ahead of time. So what advice would I give a new librarian or a new liaison trying to start out? I think, one, be seen by your department and be seen as interested. So try to immerse yourself in the department as much as you can. So, go to events, introduce yourself to the faculty members, ask questions, do research about the department, but try to show that, really show that you care about them. I think, second, you do have to promote yourself. So when I got started, I would send emails out to the residency directors and say, hi, my name's Jonathan, is there anything I can help you with? And I would get silence. So what I ended up having to do is ambush them. I would go out to grand rounds or presentations I knew they were at, and I'd introduce myself there and say, hi, I sent you an email, is there a way I can help you? I went out and promoted some of the services we can offer to all of the residency directors and all of the chief residents, all the big stakeholders and opinion leaders. These things can feel somewhat uncomfortable, but I think, especially if you have departments where it can be hard to make contact, or people aren't really responsive to emails or phone calls, or they get lost, you have to have that high level of human touch. I think it's very important to see every interaction you have with someone as an opportunity to work with them and to answer a need. So for instance, I went out and found myself sitting at lunch with a few faculty members about a year and a half ago. And I just struck up a conversation with a radiologist I hadn't met before. And we got to talking. It turns out that we had some common interests. He was trying to figure out how to link to library resources, and I, of course, knew a lot about linking to library resources. We got together working, and I ended up as part of a great interdisciplinary team of computer scientists and physicians and myself that have now built a tool to try to improve radiology reports. And it's turned into a formal company, and we're doing pilot testing. And that's something that never would have happened if I hadn't really, A, tried to promote myself, and B, tried to find an interesting connection or a way to work together. I think you also have to take the opportunities that are given to you in terms of when you might be able to teach or get involved, but realize those might not always be the right times, and then fight for what the right times are. So for instance, when I attend inpatient rounds with neurology, and I go around with the team from room to room to room, some questions come up then, but it's a very kind of formalized time and period. What I get a lot more mileage or a lot more questions out of is when I'm there before rounds or after rounds, times that I wasn't formally invited to be there, but what no one minded if I hung around. And that's when the residents are able to be more comfortable and ask questions, and we get more back and forth. Last but not least, you have to try to identify, I think, needs and ways you can contribute beyond sort of the traditional library things, not just teaching a database or providing access to an e-journal. So, for instance, with medicine, I'm never going to become an expert in medicine. That's just so not going to happen. I have 22 departments and I have a full-time job. Instead, evidence-based practice is an area in which I can develop some core skills on how to critically appraise articles. I already know how to find good information. And that's a skill set that's outside of the things you learned in library school, but is critically important to the departments I work with. That's something they struggle with as well. And so it's something where I can offer leadership and expertise, such as putting together a workshop for how to train people and how to teach evidence-based practice concepts to others. So we saw this as a great opportunity. So we developed expertise in evidence-based practice, and we put together a 1.5-day long workshop on how to do it. And we attracted instructors to teach the courses from around the Academic Health Center, as well as students from across the HC. And we got them all working together on these same core skills. And by developing that expertise, I think you can help to prove the value of the library and of yourself, and form new connections, collaborations, and find new ways or get new opportunities to work with faculty in the future.